complaints of chest pain with a known case of diabetes and hypertension since 10 years, which on exam vitally stable on examination, ECG suggestive of inferior LMI. Then immediately took in the cath lab. Then echo was done. Echo suggestive of inferior hypokinesia with ejection fraction of 45%, and angiogram done. Angiogram suggestive of left system was normal with RCA dominant and calcified lesion in mid RCA with 90% stenosis, and distal RCA shows 80% stenosis. This was the angio shoot of RCA showing mid RCA and distal RCA 90 and 80% respectively. Immediately after the angio, patient procedure was started with the Fielder FC guide wire placed in the distal RCA with NC balloon and the PSP technique. 2.75 into 10 length was advanced over the guide wire, and the balloon inflation was up to 18 atmosphere pressure. After the pre-dilatation, two stents of size 3 into 28 and 2.75 into 40 mm were placed and deployed over the mid and distal RCA respectively at the pressure of 12 to 14 atmosphere. And post dilatation done with the 3 NC balloon with 14 to 16 atmosphere pressure. Immediately after the post dilatation, sudden the perforation occurs at the proximal stent. As soon as the perforation was seen, same balloon was inserted over the same guiding, and the balloon inflation was done at the same time. It placed for the 2 to 3 minutes, and graft master at the leak site, which was which was placed over the leak site, and perforation was closed at the same time. Patient was maintaining there is no hypotension or pericardial effusion at the time. Serial 2D echo was done for 3 to 4 days. It showed no signs of pericardial effusion. Patient kept in CCU for next 72 hours, and patient discharged after that. After 1 year, repeat angiogram done, which was normal. Take home message for this: there is perforation or potential fatal but avoidable complication of PCI. It can be avoided with careful handling of equipments. High index of suspicious is the key. Stop the bleeding first. Prolonged balloon dilatation is always indicated, and even simple looking procedure can complicate at any time. Thank you, sir.
Was this all your own work, or did somebody else help you?
Yes, sir.
Were you the primary operator or was somebody else?
Yes, sir. Bapna, sir. Dr.
He was not the primary operator.
He was not the
I'm
primary.
only joking. Could you show us the first angiogram? Could you back and show us the very first angiogram? Any comments, questions?
I think it was a well-managed complication. I think points here are, once you notice the perforation, one thing is a balloon tamponade. Check for the pericardial effusion. Take a contralateral puncture also. For sometimes you need to put a ping pong guide also in such situations. If it's a massive like perforation into the pericardial cavity, then you won't get time to put till the time you take out balloon and put a stent, the patient might collapse. So better to take a contralateral puncture and put a ping pong guide and put one more wire, and if you need it, just deflate the balloon and put a stent from other side. That can be done. And but the main thing is putting.
Anybody thinks that the stents were oversized?
Yeah.
Yeah. So I think yeah.
Well, the question is here: did you post-dilate your stent balloon with the stent? Did you use the stent balloon to post-dilate the whole thing? So you implanted the stent. Did you do some further dilatation with the stent balloon?
Did you post-dilate with the stent balloon?
No, it was a separate.
No.
Yeah,
He didn't.
That's the problem.
That's a semi-compliant balloon.
And this is what I was speaking about. Know the compliance of the balloons you are using. The stent balloon is a semi-compliant balloon. If you inflate it to 16, 18 atmospheres and it's in a difficult lesion, then it will become 3-5 and it will perforate like this. So
I don't use the stent balloon. He used a different balloon for post.
But you know something, most people end up trying to first post-dilate with a stent balloon. And that is a mistake we often make, especially when we have already borderline oversized the stent.
Go prior to this.
Go back.
He has, I think, oversized with the stent balloon itself. The stent itself, after the second stent it has got.
It has perforated at the overlap zone. So at the overlap zone, if the proximal stent is a bit more oversized,
Yeah,
it causes
so-
a laser effect and goes into the...
So I understand why he has done it, because there was a mismatch in the size of the proximal vessel. His guide was abutting, it was coming right up to the point where there was a little roomy RCA, and then the plaque kind of started there. And he tried to put in rather long stents.
Yeah, but at the same time, the right coronary artery is supposed to be the same size at the ostium. This looks a relatively innocuous vessel. And what we've probably got is some negative remodeling in the mid vessel that we haven't
Was the
appreciated.
perforation before post dilatation, or I think it was just after the stent. So the stent caused the
Sorry, I
perforation.
cannot show.
Next
Look,
slide.
The stent is here underexpanded in that part. And then he goes and post-dilates exactly
This is a
there.
post-dilatation balloon.
So he
yeah.
finally opens the crack, he cracks the ring with a big balloon and he has a perforation. It's a very normal mechanism.
Oh yeah, but it's there's probably a nodule on the inferior wall, you know, and again, I guess we're repeating ourselves. It's very easy to be
No, I think it
if
was
you
a ring
meet
crack.
things and identify what's going
second
on with the
problem-
length of the vessel, you know. But it looked a relatively straightforward case, I would think, at the start for wire balloon stent.
Yeah, sure.
That's the second problem is Oxford balloons actually. Oxford balloons have different expansion characters actually. They expand much more. So was it an Oxford balloon? So a 3-point balloon might become a 3.75 in Oxford balloon actually.
But it looked like it was after the NC balloon. If you go back one, looked after was the NC balloon in the.
Because the Oxford NC balloons are not NC. So the first time, my first PCI here in India when I was like 10 years ago, when they gave me an Oxford balloon and I went to 24 atmospheres, it blew up completely everything because they behave just differently. They're not non-compliant anymore.
So that's Oxford balloons. You have to be very careful actually. Yeah.
So anyway, well presented.
Brilliant
This is
case,
the
well
first
done.
time you're presenting. God bless you. You did very well. Thank you. Give him a big hand, guys.